Yeah, a number of diseases that are acquired tropical diseases, if not recognized early or not properly treated, can have devastating outcomes. And unfortunately, I see this on a daily basis in my practice. We have people who travel and come back with very serious, whether it's viral infections or parasitic infections. And though in good hands, they can be very easily treated without seeking the correct care or going to a physician who doesn't understand the implication of these diseases, they can be misdiagnosed or missed. Just like any specialty, not every doctor is good at everything. And certainly if you are traveling, you do acquire infection, particularly a fever while abroad, you should seek an expert within infectious disease when you come back home, because otherwise it can potentially be a disaster. And most Americans, we're used to excellent health care here in the United States. And it's important to understand that throughout the rest of the world, that's not the same. Medicine is not standardized, resources are not allocated the same, and if you get sick abroad, often you're not going to be receiving the medical care on the same par that you would back in the United States. And also people often think, well, I can just fly home, but the reality is if you have a very grave medical problem, you may not be able to get on a plane. The airline might not let you on a plane, and if you need to be medically evacuated, it could potentially cost up to $50,000 to $100,000. And guess what? Health insurance doesn't cover that. So unless you buy sort of pre-travel insurance that would cover what we call medical evacuation insurance, it can be a very costly mistake in the unfortunate situation that you become very ill and need to be medically evacuated.